Good morning. My presentation is on fatigue. It is for structure and function of the human body, the online plus class of fall quarter term 1. And my name is Alyssa Queensberry. Let's first start off with what is fatigue? Fatigue is an extreme case where you lose your sleep. It could be anywhere from restlessness to complete lack of being able to sleep. There's many different things that can cause this, from dieting, things that you put in your body, and stress from work, family, environment. There's two different kinds. Fatigue is something that we could experience on a day-to-day basis. It's end of the day, you're really exhausted, and you go to bed, you feel better. It's something that is common. Now, chronic fatigue is what I'd like to dig into a little bit deeper. That's a disease that lasts 6 months or more, and acute is what I was describing at first. That's anything under the 6 months. So it could last for, a day to a week, up to, 6 months, and it's still not considered chronic. We'll get into that a little bit more here. What happens to your cells? So fatigue, we know how we feel on the outside. That's kind of that end result. But what happens that makes you feel that way? Fatigue will actually affect all cells, tissues, and organs in your body because it's something that is a full body disease. It will go in and it'll actually harm your bone strength, which causes weakness. It'll harm that lymph tissue, and that will start to get hard as the fatigue settles in, making it, more painful to move. This is because it's lacking oxygen and nutrients in the body. Cells begin to break down and they'll lose this resources that they have and they need to live. It will first start with one cell leading to two cells, which will then begin to break down into, the organs and have a full body shutdown. This will cause you to become lethargic and a little bit tired. This can actually cause you to go into physical harm. When you're that tired, you're not real aware of your surroundings. One example of how this happens is your heart will beat faster. This will actually cause you to breathe harder. So here's an image that I actually pulled up here. It's called from Vinebavlu, uw.ed. It's actually really kind of shows you the difference between pain, fatigue, and sensitivity. So it definitely is something that takes a lot in it. If you just have that pain and fatigue, you're going to get that little bit of a brain fog. Pain, sensitivity, that's where our headaches come from. When you're really tired and have that sensitivity, you get dizzy. But when you actually have the combination of all three, that's when that chronic word, that lasting longer than 6 months, starts to come into play. What are the symptoms of fatigue? So there's two different categories. There's a mental category where it's your mental symptoms. You're going to first notice, headaches, dizziness. You're going to feel really light. Your muscles may feel weak. People around you may notice that you're becoming more moody or on edge because of that lack of fatigue. And then more so on the physical symptoms, you may experience, again, that muscle weakness, the vision difficulty. So things may start to feel fuzzy. It may be more difficult to really concentrate on things. Symptoms do differ from patient to patient. So it is something that I may experience differently than what you may experience. And that's something that is okay. What are the treatments? So fatigue is never something that anyone enjoys to have, whether it's acute or chronic. Fatigue is actually able to be treated with medication. There's some natural ways, and then we'll go over what happens if it is left untreated. Fatigue, again, can be treated by an antidepressant, anxiety medication, or sleeping pills. Ultimately, all of that is to help relax you. These medications are designed to try and help you be able to fall asleep, stay asleep, and kind of get your natural cycle back. Now, naturally, you are able to try a few things. You can try behavioral therapy, relaxation treatments. Some of the most common ones that are prescribed would be working out and dieting well. If you're putting a lot of negative foods and ingredients into your body, switching that up, eating better, eating well, getting out for a walk, even just, around the block, getting that fresh air will definitely help work towards being able to sleep better. If fatigue is left untreated, it can lead to depression, isolation, other diseases. When you're that tired, you don't want to be out, you just want to sleep. That's all that focuses, and it really does take over your life. This also can lead to accidents and, things when you're functioning with such fatigue. You aren't being able to know your surroundings. So you're driving, you may not notice cars around you, which causes accidents. You're in your home and you trip down the stairs because you didn't notice it. These are all things that can lead to just by not having your fatigue treated. So definitely if you're having these symptoms, talk to your doctor. I do want to throw out here just a little fun fact. I know we went over a lot of great information. According to the Alberta Human Resources, 17 hours awake is equal to a 0.05 blood alcohol level. 21 hours awake is actually equal to a 0.08 blood alcohol. Now would be a legal limit. I'm here in Wisconsin. That's our legal limit. Now, when it comes down to how much sleep does the average person need? Now, children differ from adults, differ from somebody who's used to not getting sleep versus used to getting a lot. However, on average, the adult human needs about 7.5 to 8.5 hours of sleep. And that's just based on our biological clock to keep things functioning correctly. If you run on the short end, it can catch up to you. Now, if it runs on the high end, you could notice that you are oversleeping, which causes you to be groggy as well. Now, if you do have any questions, definitely reach out. I have here just a few slides of resources. Definitely feel free to check out anything on there. And really, it's something that if you believe you have, reach on out to your doctor. Thank you so much.